So when I came to Dr. Villafane for a routine cleaning, he noticed some wear on my teeth that indicated maybe I was grinding my teeth during the night, and we had a discussion about whether or not I was sleeping well. And so he asked about some of the symptoms maybe I had been experiencing related to that. And during the conversation, it was discovered that I hadn't had insomnia since I was 13. So for roughly 30 years, I have routinely not got more than 5 hours of sleep per night. I'm rarely sleeping through the night. In addition, just in the 3 months prior to this consultation, I had only been getting 1 to 3 hours of sleep per night on average. And so some of the symptoms of that are just a muddled thought process, also some joint pain, elbows and knees specifically, and some lower back pain. Part of that was also just an inability to deal with everyday stress because I was just always exhausted. And so it was just having a rough time with things because of the lack of sleep. So after the consultation, Dr. Villafane suggested, and we went ahead with the plan to make me an overnight orthotic, an upper and a lower connected by a special rubber band that would allow my lower jaw to be pulled forward and open up the air passages to my throat. He also made a daytime orthotic for the lowers only to readjust my jaw, my bite basically. And also during the night, he ordered some nose cones to use to open up the nostril passages to allow air to flow more freely and let me breathe a little better at night. So after the treatment began, there was almost immediate, within 3 days, I started sleeping 4 hours straight through. And then within a week, I was sleeping 6 hours straight through the night, getting better, deeper sleep, snoring a lot less. That was one thing that my wife, in retrospect, told me was a symptom. The elbow and knee pain, joint pain went away a little bit in that first couple of weeks, and some of it has actually gone away entirely at this point. The realignment of my jaw kind of has made eating different and speaking a little different, but it's been very helpful. And at this point, I can get about 8 hours of sleep a night, straight through most nights. And so as a result, I've been able to deal with things a lot better. My body as a whole feels better. One of the most significant physical differences is that I've lost 20 pounds and been able to keep it off, which I've never been able to do before. So yeah, pretty fantastic results. So beyond the usual, everything I described already, the improvements in my life have been a much more positive outlook on life, and that's been the really big thing, because that really affects how everything else goes. More stable emotionally because I've been getting enough sleep, feeling much less stressed. And again, being able to make healthier life changes, having the energy to make healthier life changes has been probably the number one thing too, because as much intent as I might have had before to live a little bit healthier, being exhausted and stressed out all the time, I wasn't allowed to do that. And just not being depressed all the time because I was so exhausted. So Dr. Villafane, throughout the process, has been very enthusiastic, energetic, and encouraging. Always informative, making sure I understand every step of the process, everything that was going on. one thing that's impressed me about Dr. Villafane is his ability to convey the most recent, up-to-date practices involved in this whole process. As I mentioned, we started out with nose cones, and in the interim between that and one of my final consultations, he, being in the know about how things are going forward, says, you know what, they came out with this new product that I think might work better for you. And so gave me a sample of those, and they did indeed work better. So I ended up, I'm using those now instead of the nose cones, and actually working much better for me. And so Dr. Villafane is enthusiastic not only about the process, but about making sure every treatment, every consultation brings in the most up-to-date and recent research information and things like that. And for me, that means a lot. That means he didn't just go to a class. Dr. Villafane is interested in making sure that his patients are getting the most current and best practice treatments that are available.